Hello, I'm Bob Ravenscroft, the Vice President for Advancement and Chief Development Officer at Bryan Health. I'm welcoming you to Episode 2 of Rounding on Russ. In Episode 1, we learned a little bit about him and his background. Today, what you're going to hear is a little bit about his leadership style, some of the opportunities and challenges that Bryan will face, and his longer-term vision for what he thinks Bryan can become. Sit back and enjoy Episode 2 of Rounding on Russ. Can you describe your leadership style that people can, expect?
There are some things that are important to me and have always sort of shaped how I approach business and how I approach healthcare. To me, it's really important that we're really good at the most important things. I call it best at the basics. The other one is this is still a people business. No matter how technical or business-like healthcare has become or is becoming, this is a people business first.
In your previous role, you kept us fiscally sound and on point, and in this new role, it encompasses so much more. What do you think is going to be the most interesting, challenge or opportunity for you as you transition into a much different role?
Even CFO roles these days have become very much strategic in nature and are significantly outward facing, whether it's working with the legislature, whether it's working with community leaders, whether it's working with board members. And so I've always had the opportunity to do some of that. I think though probably a main place where this will change is that I'll become even a little bit more externally facing. We know that when the board put this in place, they didn't just put me as the CEO of Bryan Health, they also put John WOODRICH as the CEO of the medical center. And it was really an acknowledgement that Bryan has grown tremendously since you and I started just a month apart. And it has a much different place even within the fabric of Lincoln and Nebraska than it had 10 years ago.
We have a new campus that, if everything works through the city, is going to be exciting. Can you tell people a little bit about what's potentially going to be happening south of town here?
As we look at building out the cancer center south of town, that in and of itself is enough to be excited about. That's the area of town that we will see over the next 5 years some tremendous growth with the Beltway coming there. But not just on south of town, we need to look north too. And we have just recently acquired, as you know, some land on the northern borders of town where we think that there's some other opportunities. It won't look like a cancer center, it won't be 28 acres, but we are looking at those areas as well because we have constituencies that we're serving on both sides.
When you think of serving the community, yet providing that highest level of care, what would you say about service line development and our core services?
Yeah, you've said it really well, Bob. We are a community hospital for Lincoln, but we are a tertiary hospital for Nebraska and outside of Nebraska, on the edges of Nebraska as well. So we're going to be continuing to look at what does that mean. Healthcare is changing a lot right now. And that means we're going to be pushing, as we always have been, care out to some of the rural communities, doing things that I would have never thought would have happened. That kind of evolution, while we can't quite imagine what that's going to look like today, it's going to continue to happen.
It made me think of telemedicine.
Yes.
That has exploded, and we have a wonderful model here. Can you just describe what your philosophy is on that and what niche that might play in meeting the needs of either the rural hospitals or consumers?
What a wonderful story that is, really doing a joint venture with a physician who approached us, Dr. Bossard, and saying, gosh, what could that look like different from what other telemedicine programs look across the country? And we really do have a very unique program that's getting highlights and written up all over the nation. I'm really proud. So as I look at that, Bob, I think that we're going to continue to see that grow differently by each region and each hospital's needs, because our commitment has always been to look at the partnership not with just doctors but also with communities and say, what is it you need for us to help you?
It seems to me there's going to be a pressure to be able to move rapidly,
right,
yet responsibly. Is that a fair assessment?
Our new competitors are different than the old competitors. These are folks like CVS and Walgreens. These are insurance companies and others who haven't traditionally been providers of care, but now have decided they're going to become providers of care. And they're not going to be wanting to move at the same rate that hospitals are used to moving. So our challenge is to make sure that we're moving at a proper speed that keeps up with those changes and keeps up with the challenges by our competitors, but also moves at a pace that is safe and deliberate for the well-being of Bryan and for our consumers.
Give us a glimpse of what you think your first year is going to look like here.
Well, just on a personal level, I think that my day-to-day is going to be spent doing several things. Number one, really filling up the final slots on the senior team. That's going to be important to us. We're going through strategic planning and then continuing to figure out what sort of those day-to-day rhythms look like. And then how do we get even better, because that's what we're about. We're doing our work today, getting a little bit better tomorrow.
I hope you enjoyed hearing Russ's vision for Bryan Health and the opportunities and challenges that we're going to have to collectively work on over the next few years. And in episode 3, backed by popular demand, are going to be questions from employees that they submitted to ask Russ.